Hello, I'm Dr. Gail Mallard-Warren, an OBGYN who's been practicing in the Fresno area for over 36 years. I'm also the proud owner of Body Logic Med Spa, a med spa that specializes in the science of woman. And if you haven't noticed, I am a woman who's been through some of the changes that we see as we age. So that's why I'm here today to talk about the MonaLisa Touch. It's a novel laser for your gynecologic health. And yes, it's a problem that most women experience as they get older, and they don't know who to talk to about it, and they don't say anything, and they tend to suffer in silence. But it really is okay to talk about it, and that's why I'm here, to give you some insight and some information about things that will help you get through this transition period as we get older. Just remember, you are not alone in this time of your life. Millions of women suffer from the changes that happen as we get older, as we go through menopause and we see drop in our estrogen levels. Some of the symptoms that are experienced are called genital urinary syndrome of menopause, formerly called vulvovaginitis and vulvovaginal atrophy. And what that means is there's dryness and thinning of the vaginal and vulvar tissues, which leads to burning, painful intercourse known as dyspareunia, and even some lower urinary tract symptoms such as painful urination, urgency, and frequency. Because of the drop in the estrogen level, there are actual physical changes to the lining of the vagina and the skin and epithelium in the vulva area. When the estrogen levels start to decline, the epithelium gets thinner and becomes more susceptible to trauma. And it's this thinning of the epithelium and the lining that causes the symptoms. Because the issue has been lack of estrogen and its effect on tissue, our treatments in the past have only been geared to replacing estrogen. So as you probably already tried and known, there are estrogen preparations that are creams, gels, pills that you can take by mouth or insert in the vagina. There are rings that you wear called the S-ring, which is penetrated with estrogen and gradually releases it into the vaginal mucosa. Then, a few years back, Ospina came on board, which is a non-estrogen preparation that was specifically designed to treat painful intercourse called dyspareunia. And then non-hormonal, such as Replants, which was just supposed to replace vaginal dryness with a synthetic lubricant. The question you're probably asking is, how does it work? Well, the MonaLisa, as I mentioned, is a fractionated CO2 laser. And when the laser is fired, it causes tissue injury that is at a calculated level, and the injury triggers the healing response of the tissue, which restores it back to the premenopausal state. It has been around since 2012 and was released in the United States in 2015. And I was one of the first doctors in the whole state of California to bring the MonaLisa Touch to my patients. So now we have something that actually works and can work for all women, and it's the MonaLisa Touch, which is a revolutionary new procedure, a laser procedure that women have called life-changing. I'd like to thank you so much for watching this webinar. If you have any questions, please call us at 559-435-6445. Again, I'm Dr. Gail Mallard-Warren, an OBGYN, and I hope to see you soon. Have a great day.